I'm Hinds, and here we are at Wolf Creek Pass, Colorado, where I wrote the book that we're going to discuss. It's Healing the Pain of Heartache. A pain doctor examines the broken heart syndrome. And the reason we're here is this is where I did write the book. Nature has been very inspirational, and there's a lot of metaphors in the book from nature, the river, and animals. And I do believe that we're back here now to discuss the book after it's been written. Heartache is very dangerous. Heartache can be fatal in rare cases and can cause long-term chronic physical consequences. My book provides new medical evidence to support our intuitive knowledge that heartache is more than just an emotional state. Why does heartache feel so physical when we're taught that it is primarily emotional? We all seek evidence-based medicine when we're in the emergency room, but we also want recognition of how emotional suffering can affect our physical well-being. I do think I have some credibility to write a book on heartache because of my various relationships with the heart. Many years ago, I was an open heart anesthesiologist working with the surgeons. My job was a concrete relationship with the heart, a technical relationship, a left-brain relationship, keeping the heart alive while the surgeons operated on the heart. Then in 1985, because of my own enlarged heart and a mitral valve prolapse, I actually went across the Atlantic to have a French surgeon repair my heart valve. And I actually was the first American that he operated on. They weren't doing that in the United States, and I was lucky enough to have the knowledge as an open heart anesthesiologist to know where the resource was. They weren't doing it because of the medical legal problems. And so I had the heart operated on, and here I am 25 years later and feeling very grateful for having had that repair. But it was yet another relationship with the heart. Then in 2003, the devastating loss of a daughter at age 20 acquainted me with the all-encompassing reality of heartache. So with these different relationships with the heart, when I read in 2005 in the New England Journal of Medicine how Johns Hopkins had in the cath lab delineated all the physiological heart dynamics that are associated with heartache, I felt, since I had been an open heart anesthesiologist, that I could bridge the gap between the emotional aspects and the physiological aspects of the heart. So it was my challenge to close the gap between the hard science of evidence-based medicine and the soft science of intuition. The hard science treats the heart as a muscle. The intuition treats the heart as a metaphor. So that's what I've done in this book. This book is not a manual for recovery from grief. Rather, it is a companion book for those books that provides a medical perspective on heartache as a legitimate pain, as important as any other medical problem or any other pain, and needs to be treated so proactively to avoid some major complications. I also wanted to educate the general public and medical community and to help them enlarge their concept of heartache, and again to be able to recognize and treat heartache proactively. Heartache sufferers, their family and friends. Heartache is not only the loss of a relationship or the loss of a loved one, but it can also be the loss of a sense of worth, loss of hope for the future, like infertility, miscarriage, the loss of a job, loss of a limb, chronic debilitating illnesses. So it's really all-encompassing. This book is also a resource for heartache sufferers and families to think of new directions and insights of how to work with heartache and how to act proactively with heartache, treating heartache. It's also for healthcare providers. Many healthcare providers are unaware of the new medical evidence, the profound new medical evidence on the dangers accompanying heartache. For them, this book brings heartache front and center on the radar screen. So hopefully the medical professionals will add the heartache question to their intake, history and physical. And medical professionals are taught to treat the whole person. This book is a template for treating the whole person, and in this case, treating heartache. Whether one is a medical professional or a heartache sufferer, or both, I hope my book provides information and insight to bring healing to some of the deepest wounds of the heart. It's bringing heartache out of hiding. In our society, some people are embarrassed about heartache. Healthcare professionals frequently don't take it terribly seriously. Relatives say just get over it. So bringing heartache out of hiding is really what we're doing with this book, how it will benefit people. I'd like to say that acknowledging heartache, first of all, is very important, and then learning how to recognize heartache. And treating heartache and rehab for heartache are the important issues. The book, again, I would say, provides heartache as a legitimate pain and anchors that concept. Again, I would say it's as important as any other illness or any other pain. So it's acknowledging the importance of heartache. Learning to recognize family members or the physician learning to recognize heartache is very important, the signs and symptoms of heartache. With acute heartache, they're frequently like a heart attack, chest pain, shortness of breath, great anxiety, feeling like there's deep pressure on your chest, pain down one arm. Some of that is it's much like a heart attack itself. And so recognizing to recognize heartache for relatives and friends and the medical professionals is key. And treating heartache, the importance of getting to the physician rapidly before an arrhythmia, irregular heartbeat develops, the importance of the physician taking this emotional crisis seriously and monitoring the heart, sometimes admitting the patient to the hospital, and the appropriate medications and appropriate psychological support and spiritual support, what is true for that patient spiritually. Also rehab. People who are experiencing a broken heart do not need to feel helpless. The reality is there will be no going back to the way life was before heartache, but rehab offers hope that the heartache will no longer define people and that there may be a new normal or a new rhythm to life. It's important to discuss some of the physiologic criteria that have been found for heartache, so the reader, whether it's a physician, a nurse practitioner, or a lay public, can have an aha experience and feel like they are learning something new, and they can enjoy the fact that they can discuss and recognize heartache as being very physical as well as emotional. Two things happen with heartache physiologically. And one is the release of catecholamines. That's a big word. catecholamines are many, but the ones that are most important and most familiar to the reader would be adrenaline, which is really epinephrine, and noradrenaline. These are catecholamines, and with severe heartache, it's been shown that there can be 35 times as many catecholamines released with acute heartache. And adrenaline or epinephrine has some negative effects at that degree on the body, such as constricting the blood vessels and the blood vessels to the heart, so that the nutrients to the heart, oxygen, are much less because of the constriction of the coronary arteries to the heart and to the other organs of the body. And epinephrine can act directly on the heart to ask the heart to pump harder. So it's really a catch-22. There's less nutrients for the heart to use, but the heart is asked to pump harder. That leads to some problems. It can lead to heart irregularities like ventricular fibrillation, which is the most common cause of immediate death in the United States. It's an irregular rhythm that causes complete disconnection of the blood flow through the body, like a sack of worms, so that there is no flow to the organs of the body, and within minutes the patient can die. And so that can happen. Also, there can be a chronicity to congestive heart failure and chronic disease forms that start with the broken heart syndrome. The other thing, the first being the catecholamines or adrenaline, the second thing that's important to realize is ejection fraction. Well, what is ejection fraction? It's the percentage of blood that the biggest chamber of the heart, which is the left ventricle, squeezes blood to the body, the percentage of the blood each time it beats. It's usually 50% of the blood in the left ventricle is pumped out to the body, to the heart, to the other organs of the body. But in heartache, it can go down to as much as 15%, so that the blood flowing to the body with its nutrients is markedly decreased, and to the heart, so that the ejection fraction, again, the amount of blood that is pumped out by the left ventricle, can drop precipitously, causing organ failure in the body, including organ failure at the heart. So these two parameters are the newer understood physiologic things that can be happening during heartache, and that's why we now know that there are some real dangers to both acute and chronic heartache, physiologic dangers. I think it would be well to illustrate this with some stories. When I was the chairman, the head of the intensive care at St. Vincent's Hospital in Santa Fe, New Mexico, we had just had a motorcycle accident, and a young 25-year-old man was on a ventilator, and as things happen, he was brain dead. The EEG test for the brain waves was flat, and his heartbeat was becoming irregular and slower. It was clear that he was dying, and it was my job to go talk to his wife, who was in the holding area, along with 5 children from ages 2 to 10. So I tried to be very compassionate and went out to the holding area to discuss this with his 29-year-old wife. And as I said this to her, she put her hand to her heart, and she told me, she said, "I'm really profoundly worried that these children are going to be orphans, because I feel like my life force is leaving too. I feel a great pressure in my heart. I feel like I can't stand here." And she sat down. "I feel like in any moment now, I too am losing my life force." And at that point, years ago, I thought that the thing to do was to be very compassionate and to help her treat this emotional crisis. And so we did get some support from her friends at that point and pastor. However, now I would be much more cautious. I would at least take her to the emergency room. We would do rhythm strips, possibly admit her to the hospital, watch her closely, possibly treat any arrhythmia that developed, give supportive treatment, and institute right away interdisciplinary care, spiritual, should she have a spiritual belief system without question, friends and family, and develop a pattern of rehab after leaving the hospital. Even though she was young, heartache can happen, devastating things can also happen to younger people, although it's much more common that people with already pre-existing problems such as high blood pressure, coronary artery disease will have a fatal or a long-term consequence. Another story that might be interesting to you, in the pain center in Albuquerque, we had a wonderful gentleman who had rheumatoid arthritis. He was 80. He would come in his wheelchair with his service dog named Buddy. And the service dog was a mix, a lab retriever mix, a wonderfully bright dog. And this patient had developed this warm relationship with this dog. Not only was the dog his biggest emotional support, but did several things for him. Would actually go to the refrigerator and bring him a pop and open doors. So what happened was that he had raised a big family and had educated all of his kids well, and his kids became very successful. They were off in London and Atlanta and Mumbai, and they called him occasionally. But as you know, the nuclear family in the United States has changed, and the success is looked at how successful your kids are, and I'm sure they loved him and he loved them, but the problem being he was left and his emotional support was his dog. Well, the nurses read in the paper that this particular patient had died. We were all sad, but we also learned that his service dog had passed away 1 week before. So now we know what does happen, especially with the elderly. Heartache can lead to death because of these physiological parameters. I also want to tell you that bringing heartache out of hiding is an interesting concept. And to drive that concept home, I'd like to tell you about what happens in the heartland of New Mexico. We're very near, we're about 30 miles from the border, and that's where I practice medicine. There are pueblos, Indian tribes, that have feast days every year, and for hundreds of years, the rhythm of life has been their feast day, and lines of dancers, some of them illustrating deer and antelope and buffalo, will be lined up, and there's a chorus and drumming, and there is a real rhythm to the dance. And out from behind an adobe wall will come an elderly spiritual head. It's their spiritual leader. And in this case, the spiritual leader is painted often black and white stripes as a clown. It seems a contradiction, almost a paradox, that the spiritual leader would be a clown. But his job is to weave in and out of the dancers and through the community and to bring out the hidden relationships or the buried heartache to the community so that it is not swept under the sand, and so that it is present and can be dealt with proactively. But in our society, so many people don't have that community, and they're embarrassed about this, or heartache is not something they want to talk about, and so it's kept in hiding. And I think it's an interesting illustration that communities, sometimes third world communities, have a much more effective way of proactively treating heartache.